Now, let us look at the topic surgical drains, knots, and sutures. Surgical drains, knots, and sutures. The questions that are being asked from this topic are Romovac drain and Jackson Pratt drain. Then types of closed drains, reef knot and surgeon's knot, skin suturing principles, and suture materials. In suture materials, the questions come under the pattern of the following are absorbable except, or the following suture materials are non-absorbable except. And the next is staplers and its uses. Now, let us enter into the drains and the knots. Starting with the drains, knots, and sutures, let us begin with drain types. Once a particular surgery gets over for a patient, they will be held with, or they will be connected with tubes and drains so that any pus or excess fluid or collections get out of the system through the drains. Now, there are two types of drains, they are open drains and closed drains. These open systems are obsolete now, so they are not really used nowadays. Whereas closed drains empty into a bag or container. We will look at their types shortly. And now, this is the open kind of drain. Where this is a corrugated tube, it might be a corrugated rubber tube. Consider this to be the abscess cavity. And here the soak dressing, the dressing which is used to soak is placed here. Now the closed drain types are as follows. They are divided into 5 types: Romovac suction drain, Minivac drain, Jackson Pratt drain, abdominal drain, and underwater seal bag. Now let me drag and drop their images. I had pre-prepared with images before the video recording so that it will be easier for me and less time consuming. I have left the Minivac because it is a smaller version of Romovac. Both are similar. Now, closed drain systems are divided into 5 types. They are Romovac. Let me write Minivac here itself. Then here this is Jackson Pratt. Then this is the abdominal drain, and this is the underwater seal bag. Now all these are closed type of drains, which means that the collections go and get collected into a container. Now this has got negative pressure, because on pressure this would promote or produce a suction force which pulls the materials inside. So it has got negative pressure. Used after mastectomy, thyroidectomy, neck dissection. And in mastectomy, there is one thing to be noted. In mastectomy, it is removed. In mastectomy, the drain is removed when output, the fluid or whatever output, decreases to less than 40 cc for 2 consecutive days. At that time, it is supposed to be called like that. And it is avoided in abdominal surgeries due to risk of perforation or pulling of the abdomen and leading to like suction effect. Maybe omentum or other intestinal contents may get into the this rounded tube due to the negative pressure. Now mini vac is a smaller form of romovac, while this is used for sentinel lymph node biopsy. Is used after sentinel lymph node biopsy. Now Jackson-Pratt drain. This is also negative pressure drain. These have flat tubes and it can be used in abdomen. Now this is a closed drain. Abdominal drain is a closed drain and there is no negative pressure. What is this? This is an underwater seal. This tube is submerged underwater. This is the level where water is supposed until which water is supposed to be filled, so that the tube gets submerged in water and it is connected to chest tube. This tube is connected to chest tube. These are about the drains. Now we are going to go into the knots. Now knots have the following types. Square or reef knot, which is the most basic knot, and there is granny's knot. There is a small difference between the square knot and the granny's knot, and there is another knot which is the surgeon's knot. The surgeon's knot is the one which doctors usually use or interns usually use. Now let us have a look at these. So square knot. Square knot is produced by a single throw, then another single throw, but the threads are getting crossed. So one time the thread is pulled towards the surgeon and then the thread is pulled away from the surgeon. Whereas in granny's knot, it is not done. Every time it is pulled in the same direction. So the difference between square knot and granny's knot comes as here in this area. Let us note these areas. There is an upward crossing, whereas it goes down here. Here both are coming upwards, and the same goes there. So what do we understand? These square knots are much more stronger than those granny's knots. That is what we get to understand from this. Now the surgeon's knot. The surgeon's knot comes usually when two throws are given for the first time, and then one single throw is given. We get a surgeon's knot. With this, the types of knots get completed. So these are the knot types, and if you want to refer to the videos of knot tying, you can look at them at the channel. Just look into the playlist of learn surgery, and you will be seeing the first video will be about knots. Now with the knots completed, we will get into the sutures. So the suture types. Before that, let us look at the basic rules of skin suturing. The rules of skin suturing are based on these images. This one image and this another image. And then we get the types and then the rest. So the skin suturing rules can be summarized with these two images. Let us get into skin suturing. In skin suturing, first let us have a look at what these images tell to us. These images tell that the needle must enter the skin at 90 degrees. The needle must enter the skin at 90 degrees, and skin suturing, bowel suturing. In skin suturing, we are supposed to get everted edges, whereas in bowel suturing, you need to get inverted edges. Why is that so important? That is important because everted edges are needed in skin suturing, because if it is getting inverted, epithelium contact if inverted, if epithelium contacts, there is no healing, because no vascularity. There is no vascularity. But in inverted edges, we use inverted edges in bowel suture because we don't want bowel materials to leak out. We don't want leakage of material from bowel. Now, the principles of suturing are shown in this picture. Principles of suturing are shown in this picture, where if the depth of the wound, if X is the depth of the wound, if x is the depth of the wound, the distance between two sutures is 2x, and the distance from the bite taken from the midline will be x. So these are the principles. With this, the rules for skin suturing gets completed. Now let us get into the types of sutures. The types of sutures are a whole lot as seen. Let us get into the types of suture. For the types, let me bring the images. Yes, I don't have a simple suture here. Simple suture can be called by this one. This one shows a simple suture. Mattress sutures are these. These are mattress sutures. Then this is a subcuticular suture. After subcuticular, we have the rest other kinds of sutures. These are the rest other kinds. Just knowing the names for now will suffice. For just names, I'm putting it up just for the names. Until then, let us see why we call this a granny snot, because it is really loose and it is not suitable for surgery because it can turn out to tear, like it will unknot itself easily. It is a quite weaker one. Now let us look at the types. The types are simple suture. This one single one will be a simple suture. These two are mattress sutures. These two are mattress sutures. This is a vertical mattress suture and this is a horizontal mattress suture. The thing with mattress sutures is that it causes skin eversion. Eversion is what we need in a skin suture, and also hemostasis. We get eversion and hemostasis. So the horizontal mattress suture. The another fact about this is that the horizontal mattress suture has the least cut through rate. Cut through rate. What is the meaning of cut through rate? Cut through rate means while pulling the suture, when we are trying to make it taut, it might get cut. The skin might get cut along with it, and it is happening the least in horizontal mattress suture. So least cut through rate means least chance of tearing up the skin. Least chance of tearing up the skin. Then this is subcuticular suture. Subcuticular suture is being done it is commercially better because nothing is seen outside, everything goes under the skin, and it is done using a 3O monocryl. Monocryle is a transparent one, and usually skin is done using a cutting needle. These 3O monocryle cutting needle, we will have a look at these in a while. The other sutures are continuous suture. This is interrupted suture, and there is a buried mattress suture for which I did not find any image. There is a lock suture, a purse string suture, and this is a normal one. This is for near for suture technique, and this one is shoestring shoestring technique. Let us have a look at the one by one. This continuous suture is ended with Aberdeen's or cobbler's knot for closure. This continuous suture is ended with Aberdeen's or cobbler's knot. Now, interrupted suture is all simple sutures in a row, and buried mattress suture, I do not have the image for it. There is a lock suture. Lock suture is continuous suture with locking, and this helps in the distribution of tension. This helps in the distribution of tension. And now the purse string suture, it is used to bury this abdominal, like appendicular stump, and there is cervical encirclage. Far near for suture is used for obliterating a large cavity, and there is shoestring technique. It is used in fasciotomy wound closure. Fasciotomy wound closure. In fasciotomy wound closure, where there is gradual tightening, and it is healing by secondary intention, healing by tertiary intention, or delayed primary closure. With this, the types of sutures get completed. Now we get into the needles and the actual suture materials. Let us have a look at the needles first. First few images for these needles. Having brought the images for the needles, let us have a look at them. When it comes to needles, there may be two types, either a round body needle or a triangular body needle. A triangular body needle may be either cutting needle or a reverse cutting needle. A cutting needle or a reverse cutting needle. So there is a round body and a triangular body, and the types of triangular body we have got cutting and reverse cutting needle. Now these are round body. What is the difference between a round body needle and a triangular body needle? So these round body needles, the thing with round body needle is that it splits the tissue. Whereas these cutting or reverse cutting needle, they cut the tissue. So splitting of tissue is atraumatic, just relatively atraumatic, whereas this is more traumatic. This is used for soft structures or delicate structures. They are bowel, bladder, blood vessels, common bile duct, and these are used for hard and tough structures like sheath, skin, and fascia. Where are we now? The parts of the needle. The parts of the needle are, the needle has a body, a point, and a swaged end. The swaged end is the end where the suture material is attached, and we use a needle holder. The needle holder has got crisscross serrations in it. The needle holder, now the needle holder is held here, that is 1/3 from the swaged end and 2/3 from the point. So this is where the needle holder is placed, held. The needle holder is held and it has got crisscross serrations. It has got crisscross serrations on it. With this, the needles get over. These are the different shapes of the needles. With this, the needles get over. Now let us get into the sutures. In the sutures, we have got different colors. Different colors. There's different colors. Then for the suture material, this is the suture color coding and there is a suture numbering. The suture color coding is being useful for differentiating from what kind of a suture material it is. Yellow and brown are for catgut. Yellow is for plain catgut and brown is for chromic catgut. Blue is for proline, black for silk, violet is vicryl, blue is proline, then white is cotton. I don't know whether it is used. Violet I've seen, black I've seen, blue I've seen, brown I've seen. And there is a steel one, it is used in anatomy closure. You'll be seeing it soon. Now there is a suture numbering. The suture diameter is usually 1/10 of a millimeter. 1/10 of a millimeter. So there is number 1, 2, even 11. The 11.0 is the finest. Number 1, it is the thickest. This is the thickest. This is the finest. After the suture numbering, we are going to have a look at classification. Classification, the suture materials can be classified into natural and synthetic based on its origin, monofilament or braided on its texture or look, whether it has only single filament or it is braided, and absorbable or non-absorbable. After that, we will be having a look at each single one of them. Types of suture material. What are the types of suture material? What are the types of classification? Three basic types of classification: 1, 2, and 3. Based on the source. Based on the threads. And absorbability. Based on the source, it can be natural or synthetic. Based on the threads, it is monofilament or braided. And absorbability, it is absorbable or non-absorbable. Or natural sources and synthetic sources. You got the following examples. Natural, we have silk and catgut. In synthetic, we have got proline, vicryl, then monofilament, that is, it has got only one thread, but in braided it has got several threads in it. Monofilament are catgut, proline, nylon, monocryl. Whereas in braided we have got silk and vicryl. In absorbable and non-absorbable, we have another classification which is natural and synthetic. Again, natural and synthetic. Another classification is natural. This one is synthetic. Again, natural and synthetic. Natural and synthetic types. These natural types are sensitive for antigens, or else these natural ones have naturally got antigens on them, and they may elicit an inflammatory response due to that. And in synthetic, it is inert, so there is less tissue inflammation. These are inert, so less tissue inflammation since they are synthetic. And the most inert is synthetic non-absorbable suture. It is the most inert. It has got the least inflammation. Least inflammation is seen in synthetic non-absorbable suture. And there is dissolution here by proteolysis. Here there is a dissolution by hydrolysis. Now, monofilament and braided suture. Monofilament sutures, they are difficult to handle. Because they have a strong memory. First of all, what is a memory? Memory is the tendency of the suture material. Memory is the tendency of a suture material to coil up into the way how it was packaged. Braided is easier to handle. And has less memory. Less memory and easier to handle. But the thing with braided suture is that it has got these gaps in it. These gaps may be in an area for microorganisms to get accumulated, and so it is a bad choice sometimes. Now, absorbable and non-absorbable sutures. There is natural absorbable, synthetic absorbable, natural non-absorbable, and synthetic non-absorbable. Natural absorbable sutures include the following: catgut, then chromic catgut. Synthetic absorbable sutures include monocryl and vicryl, then polydioxone, that is the PDS which I have been writing. So the synthetic are monocryl. Monocryl we had seen somewhere else. What is that? Subcuticular sutures, yes. Then vicryl, polydioxone, which is the PDS which I had been writing before. Natural non-absorbable sutures are silk. Silk is the natural non-absorbable suture. Synthetic non-absorbable sutures are Proline, proline, nylon, or ethylon. Ethylon. Then we have got steel. Steel, I had just mentioned about steel earlier. Then we have polyester or ethibond. Then we have got polybutester. Polybutester. With this, we have completed the types, just the classification. And if we want to have a look at a few more details, let us go with the absorbable, natural absorbable suture, which is first one is catgut. It is derived from gut of not cat, it is sheep. In detail, gut means submucosa. Submucosa of gut of sheep, and the phagocytosis and enzymatic degradation occurs within 7 to 10 days. Enzymatic degradation and phagocytosis within 7 to 10 days. And there is something called as chromic catgut here. Chromic catgut has got a tensile strength of 21 to 28 days, and it has got a complete absorption within 19 days. Complete absorption within 90 days. Synthetic has monocryl. Monocryl is a transparent suture. Transparent suture. It is a monofilament suture. It is used for subcuticular suture. It is used in a 3.0 or 4.0 and used with cutting or reverse cutting needle. Used with cutting or reverse cutting needle. Reverse cutting needle. Vicryl. Vicryl is braided. Vicryl is a braided suture. Vicryl other name is polyglactin. Braided suture dissolves in 60 to 90 days. Used in common bile duct anastomosis, 5.0 needle, bowel anastomosis, bladder anastomosis, 3.0 needle. All these are delicate structures. They use a round body needle. Sorry, these are the sizes of the material diameter. These are this is more finer. Now polydiaxone. Polydiaxone is a monofilament. Dissolves within 180 days. 180 days, and it has the same uses of vicryl, and it can also be used in tracheobronchial repair. Vicryl uses plus tracheobronchial repair. This vicryl has also got further subclassification within them, like there are special types of vicryl. Vicryl plus, barbed vicryl, and vicryl rapid. This vicryl plus, it is coated with antibiotic triclosan. These, as already told, is braided, and we knew that braided there is a chance of lodging within those gaps of threads. So, antibiotic triclosan coated one is used to reduce the risk of infection. Then, barbed vicryl. I had got an image of it. Barbed vicryl. Here it is. Barbed vicryl image. Let me bring it here. So this is the barbed vicryl. Barbed vicryl image. This barbed vicryl has got thorns. Have a look at this. These have got thorns, and it is used in facelift surgery. It has got thorns and it is used in facelift surgery. And the disadvantage is that it is painful. Vicryl rapid is made of polyglactin 910 910. It dissolves rapidly. That's why it has got the name rapid. Dissolves rapidly within 21 to 28 days. After looking at the types of vicryl and after that polydiaxone, we get into non-absorbable sutures. Non-absorbable sutures are silk. Silk is black and it is braided. So, as we know, a silkworm. The use is 2O 3O. It is used cutting needle in the skin. For drains, we use 1 or 1O or 2O with a cutting or reverse cutting needle. And for second layer of bowel anastomosis, what is second layer of bowel anastomosis? We will look at it in a short while. Second layer of bowel anastomosis, we use 3O silk with a round body needle. Now we get into synthetic non-absorbable sutures, starting with proline. Proline, as we know, is blue and it is monofilament. And the main use of proline is used as hernia mesh. Hernia mesh, and it is used to close abdominal sheath. It is used to close abdominal sheath, and it uses a rule which is called as Jenkins rule of mass closure. Jenkins rule of mass closure, which states that the length of the suture must be 4 times or more than that of the length of the wound. Now, the other uses are vascular repair. Then nylon. Nylon is a monofilament suture. It is used in skin suture. The finer ones like 10 point is used for cataract suture, then nerve and tendon repair. Skin suture, cataract. In cataract surgery, we use finer ones like 10O and nerve or tendon repair. Then we have got steel suture. It is used to close sternotomy incision. Where is sternotomy incision done? It is used in coronary artery bypass graft. Coronary artery bypass graft. Then polyester or ethibond. It is used in rectus sheath. Rectus sheath and tendon repair. Polybutester is used in plastic surgery, but it is rarely used. Now, on coming for suture removal. Now, when we give non absorbable sutures, they come for suture removal. Now, suture removal. After how many days a particular suture removal can be done? This is for non absorbable sutures. Let us see after how many days we do the suture removal. For the scalp, it is 5 to 7 days. Face, 3 to 5 days. This is the earliest. Then neck. Neck is 5 to 7 days. Thorax, 10 to 12 days. Abdomen, 12 to 14 days. Perineum, 10 to 12 days. Then, as already discussed, the bowel anastomosis should have inverted edges, and the strongest layer in bowel anastomosis is the submucosa layer. The techniques of bowel anastomosis used are summarized with these two images. The techniques are summarized with these two images. So we have got bowel anastomosis. The strongest layer is the submucosa. And the techniques, it has to be getting inverted edges. The techniques are as follows. Any technique we use, we get the same result. This is a single layer extramucosal repair. Look that it is involving a single layer. Here it is involving a double layer. Now a single layer and extramucosal, because mucosa is not involved. Have a look. Here there are two types of sutures: an inner continuous suture, and it is involving the stitching of all the layers. Inner continuous suture, and it is absorbable suture. It involves inner continuous, absorbable, all layers. Absorbable means it is vicral. Then this is outer seromuscular non-absorbable suture. What is the non-absorbable suture? Silk. And this one layer is called as Albert's layer. Or Albert layer. This one is the Lambert layer. This one is the Lambert layer. And then we have got a stapler. The staplers are two of these. This is a linear stapler and this is a circular stapler. Linear stapler and circular stapler. Lemia stapler is used in side to side anastomosis, used in sleeve gastrectomy and Zenker's diverticulum. Sleeve gastrectomy is for bariatric or weight reduction surgery. Then Zenker's diverticulum can be observed in the esophagus. The circular stapler is used in stapler hemorrhoidopexy for hemorrhoid repair and lower anterior resection or sigmoid colon cancer. Then we have got two terminologies, which is Chiattle's split and Connell loop. Chiattle's split is nothing but it is used in end-to-end anastomosis of bowel where there is not or luminal disparity, like unequal diameters, unequal bowel lumen sizes, anastomosis. We just split open the along the anti-mesenteric border for the smaller bowel, relatively smaller diameter bowel, and then we do the anastomosis, that is called Chiattle's splits. And Connell's loop. Connell's loop is taken at the edge of anastomosis, at the edge of anastomosis, and it ensures a bowel inversion. It ensures bowel inversion. With this, surgical drains, knots, and sutures are getting over. Thank you.